The human body is a complex and fascinating machine. Every organ plays a crucial role. The skin, our largest organ, is no exception. It acts as a protective barrier against the outside world. It shields us from harmful pathogens, regulates our temperature, and even helps us sense our surroundings. Understanding the skin's intricate structure and function is crucial, especially for aspiring pharmacists. The skin, a marvel of biology, comprises three primary layers: the epidermis, the dermis, and the hypodermis, also known as subcutaneous tissue. Each of these layers has unique characteristics and functions that contribute to the skin's overall role in protecting and maintaining the body. Each layer plays a distinct role in maintaining our overall health and well-being. The skin is not just a passive barrier. It is an active organ that interacts with the environment and responds to various stimuli. From regulating body temperature to sensing touch, the skin is integral to our daily lives. The epidermis, the outermost layer, acts as the first line of defense against environmental aggressors. It is composed of tightly packed cells that form a waterproof barrier, preventing pathogens and harmful substances from entering the body. The epidermis also contains melanocytes, which produce melanin, the pigment responsible for skin color and protection against UV radiation. Beneath the epidermis lies the dermis, a robust layer rich in blood vessels, nerves, and connective tissues. This layer provides the skin with its strength and elasticity, thanks to the presence of collagen and elastin fibers. The dermis is also home to hair follicles, sweat glands, and sebaceous glands, which play vital roles in thermoregulation and maintaining skin hydration. The dermis provides structural support and plays a crucial role in thermoregulation and sensation. Blood vessels in the dermis help regulate body temperature by dilating or constricting, while nerve endings allow us to feel sensations such as touch, pain, and temperature changes. This intricate network ensures that the skin can respond to various external and internal stimuli effectively. Lastly, the hypodermis, composed primarily of fat cells and connective tissue, anchors the skin to underlying muscles and bones. This layer acts as an insulator, conserving body heat and protecting internal organs from external impacts. The hypodermis also serves as an energy reserve, storing fat that can be metabolized when the body requires additional energy. Together, these three layers form a complex and dynamic organ that is essential to our survival and well-being. The epidermis, the skin's outermost layer, serves as our primary defense against the external environment. It's a remarkable self-renewing layer, constantly shedding old cells and replacing them with new ones. Within the epidermis, specialized cells called keratinocytes produce keratin, a tough, fibrous protein that gives skin its strength and resilience. As keratinocytes mature, they migrate towards the skin's surface, forming the outermost layer known as the stratum corneum. The epidermis also houses melanocytes, cells responsible for producing melanin, the pigment that gives our skin its color and protects us from harmful UV radiation. The skin is composed of several layers. The top layer is the stratum corneum, followed by the epidermis, then the dermis, and finally the hypodermis. Lying beneath the epidermis, the dermis provides structural support and nourishment to the skin. This layer is crucial for maintaining the skin's overall health and functionality. Without the dermis, the skin would lack the necessary support to remain intact and perform its protective functions. This intricate layer is a rich tapestry of blood vessels, nerves, hair follicles, and sweat glands. Each component plays a vital role in the skin's ability to sense, regulate temperature, and produce hair. The blood vessels ensure that the skin receives a constant supply of nutrients and oxygen, while the nerves allow us to feel sensations such as touch, pain, and temperature changes. The dermis is composed of two distinct layers, the papillary dermis and the reticular dermis. Each layer has unique characteristics and functions that contribute to the skin's overall performance. The papillary dermis is the uppermost layer, while the reticular dermis lies deeper within the skin. The papillary dermis, named for its finger-like projections called papillae, interlocks with the epidermis, providing a secure attachment. These papillae increase the surface area for exchange of oxygen, nutrients, and waste products between the dermis and epidermis. This interlocking mechanism also helps in anchoring the epidermis firmly to the dermis, preventing it from sliding off. It also contains a network of capillaries that deliver oxygen and nutrients to the epidermis. These capillaries are essential for maintaining the health and vitality of the skin cells. They ensure that the cells receive the necessary nutrients to function properly and to repair any damage that may occur. The reticular dermis, the deeper layer, is composed of dense connective tissue, providing the skin with its strength and elasticity. This layer contains collagen and elastin fibers, which give the skin its ability to stretch and return to its original shape. The reticular dermis also houses larger blood vessels and nerves, contributing to the skin's overall resilience and sensory capabilities. Section 5. The stratum corneum, our protective shield. The stratum corneum, the outermost layer of the epidermis, is our skin's first line of defense against the outside world. This remarkable layer is composed of flattened dead cells called corneocytes, which are essentially envelopes of keratin protein. These corneocytes are tightly packed together, forming a formidable barrier against bacteria, viruses, and other harmful substances. The stratum corneum also plays a vital role in regulating water loss from the body. Lipids or fats present in the stratum corneum act as a sealant, preventing excessive evaporation of moisture from the skin. Hair follicles, while often associated with appearance, play a crucial role in protecting our skin and regulating body temperature. These tiny structures embedded in the dermis produce hair shafts that extend beyond the skin's surface. Each hair follicle is associated with a sebaceous gland, which secretes sebum, an oily substance that lubricates the skin and hair, preventing them from drying out. Hair follicles also play a role in our sense of touch. Nerve endings surrounding each hair follicle detect even the slightest movement of the hair shaft, providing us with valuable sensory information about our surroundings. Sweat glands, essential for regulating body temperature, are found throughout the skin. These tiny glands produce sweat, a watery fluid composed primarily of water, salt, and electrolytes. When our body temperature rises, sweat is released onto the skin's surface, where it evaporates, cooling us down. There are two types of sweat glands, eccrine and apocrine. Eccrine sweat glands, distributed throughout the body, are responsible for thermoregulation. Apocrine sweat glands, located in specific areas like the armpits and groin, produce a thicker sweat that contains proteins and lipids, contributing to body odor when broken down by bacteria. Understanding the skin's intricate structure and function is paramount in the pharmaceutical field. Many medications are applied topically, relying on the skin's permeability for absorption. Pharmacists must be knowledgeable about the factors influencing drug penetration, such as the drug's chemical properties, the skin's condition, and the use of penetration enhancers. Moreover, pharmacists play a crucial role in educating patients about proper skincare practices, especially when dispensing medications that may cause skin-related side effects. From treating skin infections to managing chronic skin conditions like eczema and psoriasis, pharmacists are at the forefront of dermatological care. The skin, our largest and most visible organ, is a complex and dynamic system that serves as the first line of defense against environmental hazards. It protects us from harmful pathogens, regulates our body temperature, and allows us to sense the world around us. Plays a vital role in our overall health and well-being. Maintaining healthy skin is not just about aesthetics. It's about ensuring that this crucial barrier functions optimally. A healthy lifestyle, including a balanced diet, regular exercise, and proper hydration, significantly contributes to skin health. Its intricate structure and function are a testament to the marvels of human biology. The skin is composed of multiple layers, each with its own unique role. The outermost layer, the epidermis, provides a waterproof barrier and creates our skin tone. Beneath it lies the dermis, which contains tough connective tissue, hair follicles, and sweat glands. The deeper subcutaneous tissue, or hypodermis, is made of fat and connective tissue. For pharmacy students, a thorough understanding of the skin's anatomy and physiology is essential. This knowledge is not only fundamental for academic success, but also for practical application in the field. By understanding how the skin functions and responds to various stimuli, future pharmacists can better appreciate the complexities involved in treating skin conditions. This knowledge forms the foundation for understanding drug delivery, managing skin conditions, and advising on the appropriate use of skincare products. Pharmacists play a critical role in recommending treatments for conditions such as acne, eczema, psoriasis, and infections. they must be well-versed in the pharmacokinetics and pharmacodynamics of topical medications to ensure they are used safely and effectively, and providing patients with optimal dermatological care. This includes not only prescribing medications, but also offering advice on preventive measures and lifestyle changes that can improve skin health. Pharmacists often collaborate with dermatologists to create comprehensive care plans tailored to individual patient needs. As future pharmacists, you will be uniquely positioned to educate patients about skin health, promote early detection of skin diseases, and advocate for regular skin checkups. Education is a powerful tool in the fight against skin cancer and other serious conditions. By raising awareness and providing accurate information, pharmacists can help patients make informed decisions about their skincare, promote early detection of skin diseases, and ensure the safe and effective use of topical medications. Early detection is crucial in managing skin cancer and other dermatological conditions. Pharmacists can guide patients on how to perform self-examinations and recognize warning signs that warrant further medical evaluation, and ensure the safe and effective use of topical medications. This involves understanding the proper application techniques, potential side effects, and interactions with other medications. Pharmacists must stay updated on the latest advancements in dermatological treatments to provide the best care possible. Your expertise will be invaluable in empowering individuals to take charge of their skin health and overall well-being. By fostering a proactive approach to skincare, pharmacists can help patients achieve healthier, more radiant skin, ultimately enhancing their quality of life. Your role as a pharmacist extends beyond dispensing medications. It encompasses being a trusted advisor and advocate for your patient's health.